Welcome back to Mobility Agility Chiropractic Performance live video. I'm Dr. Mac, or Melissa MacDonald. I'm a sports chiropractor here in Edina in the Twin Cities. And tonight we're going to start off with simply discussing how to best recover after exercise. This is a question that is commonly asked. How do I get better? How do I get faster? I can't work out as often because I'm sore. So how do you get better faster so that you can do the tasks you want? Well, I have 5 steps that you can take. 5 easy steps to follow. First and foremost, water. You gotta get your water in to make sure that your muscles can appropriately hydrate, flush out any of the byproducts of working out. A lot of times our soreness is from buildup of lactic acid. Lactic acid is created as our muscles burn through the glucose and are utilized so that we can move. Once we've exceeded our tolerance, we produce lactic acid, which is what makes us sore. 2 days after working out, if we haven't appropriately hydrated, can be when we feel the most sore. And that is when we have delayed onset muscle soreness, also called the DOMS. Now, once you have that, you need to move. So step 1, drink water. Step 2, after exercising, this can be a great time to add stretching. And when implementing stretching, this increases your mobility, it helps the muscles recover, and it can allow you to move better. So step 1, water. Step 2, stretching. Step 3, do not ice. Do not ice unless you sustained an injury in that practice. Heat. Take a hot bath, do an Epsom salt soak. Allow your muscles to recover appropriately and allow them to relax. When we ice something, they get tighter and they really lock down. So it's important to heat them, and the Epsom salts allows you to get some magnesium. Our 4th step is to make sure that we eat appropriately, specifically protein. Protein is really a building block that allows our muscles to recover and actually grow. Without enough protein, we will not have enough to recover, and then we get extra sore. And then our last step is sleep. We need to actually sleep so we can heal. And a lot of times with our busy schedules, we push ourselves to the breaking point. So my 5 easy steps to recover: drink plenty of water, stretch, hot bath or hot packs, have enough protein to heal, and sleep. Some other pieces that you might want to avoid is immediately after exercise having booze. I know this is quite a common occurrence, especially here with beer league hockey. So make sure that you are drinking water and not alcohol. I know that doesn't make people very happy, but it's something to consider. I see we have some people joining in live. I welcome you. If you have any questions, please. Ooh, yes, Garrett, absolutely. Sauna is amazing. As you tune in, if you have any questions, go ahead and post them in the comments. I will respond to them. Hit like if you're watching live. Hit the heart if you're watching on replay to let me know what's going on. Even if the live is finished and you're watching it on replay, post your questions and I will get back to you as soon as possible. So as Garrett tagged in there with a sauna for a hot bath or Epsom salts, a sauna is a great option. And there are some easy sauna options for your home. I believe, Garrett, it's called a sauna rocket, right? The home sauna system that you created. It's great. It's fantastic. Not sponsored. So if we have any questions, I did have a question posted after this was done that I thought was really great that I want to discuss here. It was low back pain and pain while working out with known scoliosis. So they had an x-ray, they found out they had scoliosis, and was there anything they could do to prevent having pain? And I thought that was a great question because so many of us have some form of curvature to our spine, whether it's a scoliosis or an increased forward rolling where there's a kyphosis. How do we kind of support those? And really it comes down to working our core. And when I say core, I don't just mean the abdominal muscles. I mean the entire core, starting off with the top of the diaphragm, working down through the abdominal muscles, the back muscles, the glutes, the quads, the hamstrings, the adductors and abductors. All of that constitutes your core. And if any one of those muscles aren't appropriately working, then you can get imbalances, especially when a lot of times when we're training our core, we hold our breath. We hold our breath, we do our exercise, and then we're lifting, we're at work, we're doing something else, we're breathing, we're not bracing, and boom, we sustain an injury. So when working out and when training, we have to make sure we're doing it functionally. So for planking, if you catch yourself holding your breath, try to have a conversation with a workout partner or hum or create some system that is forcing you to breathe and allowing your core to stabilize in a functional pattern. The other thing is to make sure you're doing different movements. Over the summer, I found that my band, so I worked with a marching band all summer. There was about 106 athletes. We had a lot of low back pain when they didn't appropriately use their core. And when they're playing their instrument through a 9-minute set and having to run around and move props and dance, they were really struggling. So we started having them do planks and then play through the planks. So really creating a functionally stable core. All right, so, yep, I had a comment. When it comes to scoliosis, always making sure you're monitoring the degree of curvature and ensuring that there isn't any tethering. So with a scoliosis, so if you're an adult, the likelihood is your scoliosis isn't going to progress. Caveat, likelihood. So you still need to get regular monitoring if you have a significant change in pain. If you are an adolescent with scoliosis or a kiddo that is still growing, the curvature can get worse. And it's important to have appropriate x-rays and monitoring from someone who works with scoliosis regularly, because if it progresses too far, you may need to be braced. It may need a surgical correction, because if it becomes too much of a curve up through the back, it can actually cause organ compression and significant pain long term. So monitoring the degree of monitoring the degree of curvature with scoliosis is imperative for ensuring that you don't have long-term injury and effects. So very, very good point made within the comments. Another question that I have been asked recently is heat or ice. Should I ice my ankles after practice? Right now, with it being such a delightful time of year, quite a few athletes that practice outdoors have moved onto hard indoor surfaces such as gyms, and they're having a lot of shin splints, ankle and foot pain, and knee pain just from the constant pounding on those hard surfaces when they're used to running around on grass or turf. It's really imperative for recovery of those athletes to have heat, not ice. Ice really can cause the muscles in those areas to tighten down, and it really doesn't help the joint fluid that needs to be able to move to decrease the pain to function as well. So after practice, the best thing you can do is really heat your ankles, heat your knees, keep everything warm and moving versus icing them down. Now, caveat, if you had an acute injury during the practice, rolled your ankle, sprained your knee, not a surgical thing where you tear your ACLs. That's not what I'm talking about. But sustain some form of injury. That acute window, about an hour to 2 hours after practice, that's a good time to ice to stop any bleeding that could be occurring under the surface and creating a bruise. But if you're really just feeling achy and sore from just that chronic movement, that's when you need to use heat. So just a quick caveat there. Does anybody else have any questions? I know we have some people in for the live that have just tuned in. Other things that I've been recently asked is, especially after this delightful weekend of snow, how do you prevent injuries from shoveling? And this has become such a repetitive question. I'm actually going to make a comprehensive YouTube video this week on how to safely shovel while lifting with your legs, not over twisting, because I don't think the snow is going to go away. I really think it's just kind of going to get a little bit worse, at least until April. I'm betting on April because that's a safe bet in Minnesota and Michigan. So, doing a comprehensive video on how to remain safe while shoveling, that'll release on Friday. Another question that has come up recently is what is the best diet? What is the best weight loss diet? The answer is there isn't one. There isn't a perfect diet that works with everyone's body. And a lot of the research that shows this diet is amazing and works perfectly have only been tested in the research on males and men because they don't have the hormone cycling that can mess up with the numbers. So anytime you're reading research on the perfect diet, it typically only applies to males and can actually have really derogatory effects and cause weight gain in females. So that's something to consider. What I really believe is that you need to make a lifestyle change to best benefit what your goals are and recognize the fact that there isn't a quick fix. So, and playing with the numbers. I have found easiest thing for me is to look at the macros. What are the big, most important things about the food that I need to eat? The carbs, the fats, the proteins. And I have to look at what my goals are for how I want to eat. If I'm trying to build muscle, I need to make sure I'm consuming an appropriate amount of protein to support muscle growth. Because as a female, my body's not designed to build muscle. My body is designed to store fat for baby. So if I lose weight too quickly, I go into a fat storage mode. So eating an appropriate amount of protein, eating an appropriate amount of fat to help keep the body functioning and full, and then regulating my carbs, and I like to cycle them. So some days I eat lower carb, some days I eat higher carb, and I try not to limit or cut any main food group out. This is how I keep a steady lifestyle. Now, am I by any means the skinniest person in the world? No. But I like to keep fit and keep active. I just like food. So I have to find that balance, and that's where tracking my macros of protein, carbs, and fats has been the easiest. Now, what ratio is really dependent upon you as a person. Now, if anybody has any questions, I want to remind you, please go ahead and post those in the comments and I'll go ahead and answer those. I'm pulling from kind of some historical questions that keep coming up in practice. Hi, Tim. Thanks, Dr. Riddle. Appreciate you tuning in. I really want to make sure that we're hitting the points that get you the answers you need so that you can get back to the activities you want. We've covered how to recover faster, the 5 steps of recovery, hitting the water, stretching, taking a hot bath or using a sauna, eating appropriate food, especially protein, and getting enough sleep. So those are your 5 key things to how to recover while working out. And then we've also talked about how to reduce pain if you have a scoliosis with working on core stability. I will link a video in this live feed after I'm done that has some easy home exercises for back pain and back mobility. I'm just trying to create content so that you can keep moving, keep active, keep healthy, and do what you need to do, because we all have lives that we don't have time to sit still. We don't have time to be locked onto a sofa and not able to get up and move. I know right now, I did a pretty hardcore workout yesterday at Soul Studio, and I am really sore. And this is a great follow-up question. Is it safe to exercise through pain? Yes, to a point. I actually encourage people to push through, especially if it's muscle soreness. Push through some of that discomfort. It's going to help the muscles recover faster. Now, do you want to be heavy squatting 3 days in a row? Not necessarily. But let's say you sustain a back injury and you are scared to move. You gotta move. If you become bedridden with a back injury and you just decide to lay down and not move, your back is gonna get so much worse. So you have to make sure that even through some discomfort, you're still moving. Now, what exercises are going to be best during that injury? That's where you need to work with a chiropractor or a physical therapist to find out what's going to be best for your body, because there really are exercises that can alleviate pain, and it gives you things you can do at home to manage your pain outside of using any medications that also have side effects. So when it comes to what exercises you can do, you have to move. So right now, I'm actually having a little bit of a low back issue. Went a little heavy yesterday, and I tweaked my sacroiliac or SI joint. And when I stand up, it's a little screamy. Once I'm done with this live feed, I'm going to do some exercises to work on my core. I'm going to do some stabilization exercises to kind of get some muscles activated that I think aren't working the way I want by utilizing dead bug and hip bridges. And then I'm also going to stretch, because I know my glute muscles are so tight right now. And I think that's going to help me get the most relief. I'm also going to apply some heat later on just to kind of help those muscles loosen up. So if you're feeling pain, it is okay to work through it. I like to look at a scale of about 3 to 4. So 3 to 4 out of 10. Scale 0, no pain, 10, worst pain imaginable, have to go to the hospital style pain. If you're in that 3 to 4 range, it's okay to keep working. I don't want you to push it till you're in the 5 to 8 out of 10 pain range. So keep it tolerated to an appropriate level when working out and working through pain. So let's see, I have another question. What responsibility, this is a coaching question. What responsibility does a coach have when they know an athlete under supervision is cleared to play, but still I am having some trouble seeing the rest of that question. Let me see if I can pull it up on my computer. to see the whole thing. So, what is the responsibility of the coach if you're cleared but still using pain relievers? Ooh. So really, I don't think an athlete should be cleared if they're still having to rely on medication to modulate their pain to be able to perform. There are some significant risks from shutting down your kidneys if you're using an aspirin based, if you have too much muscle damage. So I know athletes like to just pump in those ibuprofens, pump in some Tylenols to push themselves past points of pain and be able to perform more. That's so dangerous. When I'm working with an athlete, I like to do a graded return where we modify their activity based on their pain level without medication. I really like people to only utilize it if they need to sleep, and if they're having to use it beyond that, then they're not ready for full practice yet. So it is important for both the team medical staff and the coaching staff to communicate on where that athlete is for performance levels. So for those who don't know, I'm a sports chiropractor and I work with some local area teams. So I have to be in full communication with my coaching staff on what's going on with each person on that team to ensure that they have safe activity, they have safe play. And it can get hard because when you pull someone from an activity, you usually get cussed out. If it's a starter and like the golden child of the team, you get cussed out by the athlete and sometimes the coaching staff, but it's really the sideline provider or the medical clinician that's in charge of those decisions to have one thing and one thing in mind, which is how to keep the athlete as safe as possible while they're participating. It doesn't matter feelings. It is all about their safety, because for a lot of these athletes, this isn't a full-time job. This isn't a career. This is what they're doing for fun and recreation, and they still have to go to work the next day, or they have to go to school the next day. So it's important for me to be their advocate into ensuring their safety. Any other questions for this evening? If you come up with one afterwards, go ahead and comment below. I am also pulling these off of Facebook and posting them to my YouTube channel. You can find them in either place. And anytime you have a question, if you don't want to ask in public, go ahead and send us a direct message. We'll happily answer them. We are located in Edina, Minnesota, and we have a second location in a gym starting in February. It's Soul Studio in St. Louis Park. I am super excited for this partnership and how we're going to be caring for the active individuals working out. I like to call active athletes. They'd probably look at me like I'm crazy, but with the workouts they do there, they are athletes. I want to say thank you for joining in tonight. Please feel free to keep commenting. Hashtag replay if you ask a question on replay so that I know to come back and answer it. Otherwise, have a wonderful evening, and may you get better faster, stay better longer, and remember, no one has time to be sidelined. So head over here at Mobility, Agility, Chiropractic Performance so we can help you recover as fast as possible. And have a wonderful evening. I got to go cover a girls' basketball game and keep those athletes safe. So have a good night, everyone. To keep up to date with future content, please click subscribe. Additional information is found in the description of this video.
All information, content, and material of this video is for information purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider.